everyone, welcome to another Power Talk with Archana. Power Talk with Archana brings to you Power Health in collaboration with Fortis Healthcare. Last 2 days, the Fortis Healthcare specialists spoke to you about cardiac care, bone and joints care. Today, on the third day of this Power Health series, we will be talking about pulmonology, your lungs and everything you wanted to know how to keep them healthy. Dr. Vivek Padegal is the Director of Pulmonary Diseases at Fortis Hospital, Bengaluru, India. A senior consultant, he has been voted as one of the best doctors of Dallas 2006-2010 and has more than 20 years in providing comprehensive pulmonary services. Let's welcome Dr. Vivek Padegal on board. Good evening, Doctor. How are you doing?
Good evening. Glad to be here. I'm doing fine.
Happy to have you with us, Doctor. Let's start this journey. Lungs, as you know, is the main concern in everybody's mind today. Would you like to highlight 5 ways anyone can quit smoking and have a life absolutely smoke-free?
That's a very good question. I think when anybody who's been smoking wants to quit, you really need to have the first thing, and that is the commitment to stop smoking. So once you have the commitment to stop smoking, you can actually stop. If you're half-hearted about it or you're doing it for somebody else, the chances that you're going to quit is going to be quite low. So the first thing is have a solid commitment to what you want to do, and that is to quit. It is important to be in an environment where you continue to quit. So that would mean probably avoiding people who smoke, particularly people at office, which is less of a concern these days, and friends who would smoke around you. In fact, studies have shown when 2 spouses are smoking and one decides to quit and the other doesn't, the chances of successfully quitting decreases dramatically. So in this case and scenario, it is very common to have both the wife and husband smoke, especially in your audience perhaps. And so if they need to stop smoking, I think if both of them stop at the same time, the success rate is higher. Exercise does help by increasing endorphins and countering the ill effects of nicotine withdrawal. So if you can exercise or plan on increasing your exercise prior to quitting, it will help you stop smoking. So once you have stopped, one of the hardest things to do is to stop because of the cravings. And once you can overcome the cravings, you can stop the cigarette smoking. So one of the things you can do is use things like nicotine patches. Of course, you need to do this in conjunction with your doctor because it's kind of a therapeutic drug. And perhaps start at a higher dose of your nicotine patches and come down slowly. People have tried things like chewing gums and lozenges to varying extents, and this is something which is available over the counter in many countries, and I think as well as in India. That could be tried. If it works, so be it. But nicotine patches, I think, work a little bit better. And if that still doesn't work, there are medications which can help you, such as bupropion or Champix, that could perhaps help you get off the nicotine habit.
Doctor, also tell us one thing. There are, reasons for the lungs to get infected. What are those 5 ways that can help prevent lungs from getting infected?
This is particularly important in the COVID era. So by preventing infection, I think the number one thing that people have on their mind is, how do I prevent COVID? But what works for COVID works for other things. So this is kind of a broad category. The thing with COVID is because a lot of people are asymptomatic and they can give it to you, these measures are particularly more effective. But it works for all respiratory-borne diseases, chronic from TB to acute like COVID. So a few things that we need to look at are, number 1, wear a mask. And I cannot overemphasize, especially today, wearing a mask is incredibly important. There was a small study done in China, and they found that a relative risk reduction of getting COVID or other viral diseases came down by almost 50% were general population and up to 86% for healthcare workers. So masks are pretty effective in decreasing respiratory tract infections. Now, it has to be worn correctly and worn all the time, particularly when you're in close range of other people indoors. So you want to keep the mask on and not take it off when you're talking to people or eating. These things need to be carried out for the mask to be effective. A lot of people cite mask failures, but it's not the failure of the mask, but failure of the person who wears the mask. So it's very important to have correct mask etiquette. Next thing, hand hygiene. Again, this is a COVID thing, but believe it or not, most respiratory illnesses will come either by directly inhaling or touching something that has the bug on it. So if you frequently do hand hygiene, you clean your hands frequently, even in non-COVID times, it will reduce the chance of infections. Next, don't smoke. And this kind of segues to your previous question. Smoking actually does increase all sorts of infections, and it also increases your susceptibility to infections. So if you smoke, not only are you going to give yourself chronic bronchitis from smoking, you actually will increase your susceptibility to various viral infections and perhaps things like tuberculosis as well. So it's very important to not smoke if you want to preserve your lung health. Next is vaccinations. Now, that's on everybody's mind as well. We don't have a vaccination for COVID, but we do have vaccinations for other things. The influenza vaccine is readily available. In fact, in Bangalore, it is the time to get vaccinated, and most of South India as well. And it does reduce the severity of influenza and decrease carrier states. You don't give it to other people, and it might actually prevent you from getting the infection as well. So vaccinations are particularly useful. We do have pneumonia vaccines, which are recommended for a certain population of people, particularly older people, people who have kidney disease, diabetes, who are immunocompromised for whatever reason. It is important that they get vaccinated. So pneumonia vaccines are a couple, and one needs to be taken once, and one needs to be taken every 5 years. So that is a pretty good way to prevent infections in your lungs. If you don't take care of your diabetes, you're going to get infections. And lung infections is probably one of the most prominent, particularly TB, pneumonia, and things like that. If you have HIV, make sure you're on your medications. If your HIV is controlled, we will decrease the incidence of pneumonia in your situation. Many times when you are smoking is more self-treatment. So if there's underlying emotional issues like anxiety, depression, you might actually be self-treating yourself with that cigarette. So unless you look at the underlying emotional issues, if you've got anxiety, if you feel like you're depressed or you're not happy with certain things in your life, then perhaps looking at the root cause of your addiction might help tremendously. So talking to a psychologist or a psychiatrist, going in for group therapy, which is particularly important in people who have it very difficult to quit smoking, can really benefit your chances of quitting tobacco.
Thank you so much. Thanks a lot. Lovely, lovely.